me something. I know that you want it. Come on, give me something. The night is young and so are we. So maybe you should leave with me. The night is young and so are we, baby. The night is young, so let's have some fun. If you love me right, yeah, this could be the summer of our lives now, honey. Give it to me like you know you should now, baby. This could be the summer of our lives, the summer of our lives. The sunset's on fire, tell me your desires. We're not getting tired, baby, take me higher. I'm Sunday, you love it, come on, give me something. I know that you want it, boy. The night is young and so are we. So maybe you should leave with me. The night is young and so are we, baby. The night is young, so let's have some fun. If you love me right, yeah, this could be the summer of our lives now, honey. Give it to me like you know you should now, baby. This could be the summer of our lives, the summer of our lives. Give it to me, baby, all night. We can keep on dancing all night. Give it to me, baby, all night. Give it to me, baby, all night. We can keep on dancing all night. Give it to me, baby, all night. You love me right. If you love me right, oh. If you love me right, yeah, this could be the summer of our lives now, honey. Give it to me like you know you should now, baby. This could be the summer of our lives, the summer of our lives. Give it to me, baby, all night. We can keep on dancing all night. Give it to me, baby, all night. Give it to me, baby, all night. We can keep on dancing all night. Give it to me, baby, all night. Lives now, honey. Give it to me like you know you should now.
One APIA Nevada is a grassroots nonprofit organization that advocates for policies empowering everyday Asian Pacific Islander Nevadans. Nevada is home to a growing APIA community, accounting for 1 in 10 voters. We are One APIA Nevada. Tonight's episode of Out in Front is brought to you by our season sponsors, Nevada State Education Association, One APIA Nevada, Silver State Voices, and Stefan and Marta Schmidt.
Hi, everybody. Welcome to another episode of Out in Front with Battleborn Progress. I am Shelbie Swartz, the interim executive director over here. And this week, we are celebrating a major milestone in what has been a very long journey toward finally making medicine affordable for millions of people in the United States who are on Medicare. President Biden and Democrats in Congress, including all of the Democrats of our congressional delegation here in Nevada, so Senator Catherine Cortez Masto, Senator Jackie Rosen, and Representatives Titus Lee and Horsford all kept their promises to lower health costs last year by passing the historic Inflation Reduction Act reforms that will finally enable Medicare to negotiate prices on the most expensive medicines in Part D, including Xarelto, Eliquis, Januvia, and Jardiance, and I only know how to pronounce those from all of the commercials that we see. Once implemented, 5 to 7 million more Medicare patients will save money on treating everything from diabetes to cancer, and taxpayers can expect to save over $98 billion over the next decade. But this is just the first step. Now CMS will move forward aggressively to negotiate with drug corporations in order to arrive at fair prices that patients can afford. And rather than cooperate and come to the table to negotiate, there are so many frivolous lawsuits that drug corporations are bringing forward, from Johnson & Johnson, Merck, and Eli Lilly, Pfizer, you name it. There is a drug corporation fighting against these fair prices for our patients here in Nevada and across the United States. So to help me unpack this week's historic announcement, I'm joined by our very favorite former Lieutenant Governor Kate Marshall, lower drug prices now, Representative Will Fischer, and BBP's very own Lisa Lynn Chapman, whose mother was featured this week as somebody who was falling into the Medicare donut hole and was paying exorbitant prices just to function and treat her ailments. So to start the conversation, I'm going to turn to you, Lieutenant Governor. Thank you so much for joining us. How are you?
I'm good, and I'm very happy to be here. It is a historic moment, right? We're moving forward. It's always good to do that.
Yes, and thank you so much for all of the work that you've done specifically to champion lowering drug prices here in Nevada. When you were Lieutenant Governor, what did you hear, and now, what do you hear from Nevadans about their healthcare costs? And do you believe that these negotiations will, how do you believe that these negotiations will help Medicare recipients here in Nevada?
Yeah, so first off, healthcare costs are high across the board. It's not just our senior citizens, but you can have a child who has asthma. You can have a parent who might have diabetes, or who might have high blood pressure, or who might need certain medications. And so healthcare costs affects everyone. You could have a mom and her children are healthy, but she is absolutely panicked about the idea that what if? And so she pays a lot of money for healthcare because what if? Right? You can't find yourself. She has no risk tolerance when it comes to her children and what their medical needs might be. So this is an amazing step forward. When I was Lieutenant Governor, if ever I talked to a constituent, they always brought up healthcare. If I talked to a small business, they brought up healthcare because it costs a lot and how could they give it to their employees? If I talk to an independent, a person who, an independent contractor, worked for themselves, more and more people in the gig economy, right? They talked about how they couldn't afford healthcare. If I talked to a senior citizen, healthcare was a major part of their budget, which was a budget that was on a fixed income. So it always came up. I think that the impact of this will be huge because we have in Nevada, for those people who are on prescription drugs, 1 in 3 ration their drugs. And they ration them because they don't have the money. So the opportunity for people to get a reasonable price, a negotiated price, a competitive price for their drugs means that they'll be able to get healthy. And that's just basics.
Thank you so much. And thank you for all that you've done in, both while you were Lieutenant Governor and now to lower those drug costs, lower those healthcare costs for Nevadans across the state. You are one of my heroes, so I'm so excited to have you here tonight. I'm going to turn now to Will Fischer. I'm going to do one question for each of you, and then we'll kind of do another round robin. Will, you are an expert on this topic. Can you explain how these negotiations will work and who will be impacted, and just the depth of this announcement this week?
Yes. And again, let me just start by saying thank you, not only to you for having me on tonight, but for everything all the folks out there listening did for years, not just for the past year or the 2 years, but for years, because the reality is that until 12 months ago, Medicare was legally forbidden from negotiating drug prices. This is the first time in history that Medicare has ever had the ability to negotiate drug prices, and that only happens because of the people tuning in. Can
you explain why it was illegal for that?
Yeah. So in 2003, there was a piece of legislation that was passed called the Medicare Modernization Act, and as part of the passage of the Medicare Modernization Act, it was written into law that Medicare could not negotiate drug prices. And interestingly enough, the person who led the charge on that resigned shortly thereafter and became the first president of pharma. Yes, Medicare legally has been forbidden from being able to negotiate for drug prices, despite the fact that other government agencies could. For example, I'm an enrollee in the VA healthcare system. The VA has had the ability to negotiate drug prices, and as a result of that, the VA pays on average about 50% what Medicare does for the exact same drugs. So we know that earlier this week, CMS announced the first 10 drugs that are going to be subject for negotiation. And I would just say that these are among the drugs for which Medicare spends the most money. So they're going to where big slices of the pie are, and they're starting there. And this is an initial group of 10 drugs. And I want to stress initial, because the way the Inflation Reduction Act was written, it progressively builds upon success upon success upon success through negotiations. So the first 10 drugs were announced. The fair price for those first 10 drugs will be announced this time next year, and those prices will go into effect in 2026. Next year, when those fair prices are announced, another batch of 15 drugs will be announced. Same thing. And then those prices will take effect in 2027. This time, 2 years from now, another 15 drugs will be announced, and those fair prices will go into effect in 2028. And that continues with 20 drugs per year, year after year after year, as outlined in the Inflation Reduction Act. So that's a little bit about sort of the scheme of maneuvers of how this works. CMS has set up sort of a drug pricing team that will work on this, and they will be focused on sort of everything from, savings for patients, competition, so on and so forth, to make sure, because things like this only matter when people are standing at a pharmacy counter or handed a prescription, and they're going to be able to realize the savings for themselves, right? And the way that this is written and the way CMS is going to approach this is in a way in which patients, the people who need these drugs in some cases to keep themselves or their children or their spouses alive, are going to be able to see those savings. And they already have, beyond the drug pricing piece, but still related to, medicines that people need. As of January the 1st, vaccines for Medicare enrollees have become free. Some of the ones we hear the most about are things like a shingles vaccine that prior to January the 1st cost around $250 per round. People needed 2 rounds. That's $500 right there that a great number of people are seeing. We've seen insulin capped at $35 per month. And we're only going to continue to build from there, not only under the leadership of President Biden and Vice President Harris, but also under the leadership of people like that Nevada delegation, those Nevada Democrats you already mentioned, who so stridently fought for the Inflation Reduction Act to become law in the first place.
Thank you so much for that, very thorough breakdown. That means so much to me and our guests that we're able to have that background. We actually have Steve Horner, one of our favorite volunteers in the chat, who says, thank you, George W. Bush, for Medicare not being able to negotiate prices. And also thank you for the donut hole. So speaking about the donut hole, Lisa, I'm going to come to you. For folks who don't know, Lisa is our state anti-disinformation manager. But her mother has been the star of our week. Her mother, Teddy, she was on, was it CBS News? She was telling her story about being in the donut hole and now how this will impact her life. Lisa, go ahead and tell us a little bit about you and your mom and what this means for her.
Absolutely. So it was ABC World News Tonight, and that she was on, and this makes a huge difference in my family. So my parents are on a fixed income. They are seniors. My parents are my mom's 79, my dad is 80. And my mom takes Eliquis, right? So what happened was my mom was walking one day and then she just passed out, and a neighbor found her in the road, and they got her into an ambulance and to the hospital, and they said that her heart rate was going crazy. And they said, we need you, you're going to be on Eliquis. And so she's like, okay. And so she's taking this to keep her heart rate so it stays even. It's very important. Otherwise, she's going to go into tachycardia or have a heart attack. And so when she goes to the pharmacy, she buys it every 3 months or every 4 months, 3 months. Yeah. So she buys it quarterly. For 2 quarters, she pays $180. Not that affordable, but she can do it just fine. However, for 2 quarters, it is $488 is what she pays for Eliquis. And every time she goes up there, the pharmacist goes, oh my God, this is so expensive. And my mom goes, well, it's either that or I die. So she pays this. This is what she winds up paying. She's lucky that she can afford it, but it makes it very tight, right? They basically what my parents do is play bridge and go to doctors. I mean, that's where they're at in their lives. And so healthcare is a huge thing. And so every penny that they can save allows them to have people in their home, and it allows them to entertain. It allows them to do things that they're not necessarily going to be able to do otherwise. And so we're all very excited to see the drugs reduce, and hopefully some more. My father is on several, but they're not on this list this year. So hopefully next year we will see something, and we'll be able to celebrate my dad having lower drug prices as well. So, and a little bit about me, I'm on Jardians. So I have diabetes, and I pay a lot. I pay $30 a month. That's with my insurance. Without my insurance, it's $688. There's something about 88 in drugs. I have found that when things are being priced, when I look on things, 88 is a big number. But so that's still $360 a month or a year that I'm going to be paying for Jardians. And it's because I have good insurance. But reality is I pay a lot. I pay in my drug prices as someone who's not on Medicare. I pay over $260 a month in drug cost prices. And Jardiance is not my most expensive one by any stretch of the imagination. So this is historic. It's historic, and I'm very excited to see this. I'm excited to see this for my parents, and also to see this go broader and help more people, all Americans, because we all deserve it.
Yeah. Thank you so much, Lisa, for sharing your story and for sharing your mom with us this week. It was very exciting for her to have that interview. So thank you so much. Speaking of expanding these negotiations to not necessarily all Americans, but at least all Nevadans, Lieutenant Governor, I'm going to come back to you. Can you explain a little bit about AB 250 that you worked on with Assemblywoman Considine, who is incredible? We were bummed you couldn't make it tonight, but can you explain a little bit about AB 250 and what that bill would have done here in Nevada?
Yeah, thanks. So first, I see that there's certain questions about, well, how are they choosing these drugs, and will we get more drugs? So let me just give you a high-level view of that, and so then we can talk about where we are in Nevada. So basically what the Inflation Reduction Act says is that there are certain criteria for the drugs they will choose to negotiate. And the criteria are as follows. It has to be a very high-cost drug. So you go to the pharmacy and it costs a lot of money. It has to be a high spend drug, meaning that Medicare spends a lot of money annually on that drug, acquiring that drug for their patients, right? For people on Medicare. There has to have been no competition for the drug for at least 7 years, and it can go up to 13 or 14 depending on the type of drug it is. So there is no alternative. You can't get the generic. You can't get something else that would be cheaper. And there has to be no competition coming within the next 18 months to 2 years. So if the pharmaceutical company knows that they're going to get competition, that drug won't be negotiated. So it is really drugs where the pharmaceutical company has already had at least 7 years of exclusivity. So when pharma talks to you about, well, we have to get our R&D back, right? They've had at least 7 years of exclusivity. And there are no alternatives. Okay, there are no alternatives. And it's a high cost drug and it's a high spend drug. Okay, so those are the things that create the criteria for what drugs are we going to see on that list. Now, originally in the Inflation Reduction Act, in the negotiations in Congress, originally there was language in the bill that said that these same negotiated prices would apply to private insurers. So when Lisa talks about, I have insurance, it would have applied to her. Anyone of any age who had private insurance. In the last 2 weeks of the negotiations before that bill passed, that language was stricken. So in Nevada, when people came to me and said, we need to do something about drug care prices, I said, well, we can simply take what they did in the Inflation Reduction Act. Look, the federal government has done all this work. Pharma has been at the table negotiating. Hospitals have been at the table negotiating. Everybody who is a stakeholder in this issue has been at the table negotiating, and they have come to this Inflation Reduction Act. So let's just take what they're doing, not reinvent the wheel, and say, you know what? If you're 65 and you go and you try to get your medication, and under Medicare, it costs you a negotiated price, well, you're going to get that same drug if you're standing in line behind them and you're only 62. Okay? If you're an 8-year-old and you have asthma, you will get the same negotiated price as if you're a 68-year-old and you have asthma. So what we did in Nevada was we just said, here, we'll just take whatever negotiated price the federal government comes up with, whatever they negotiated with pharma, whatever 10 drugs it is, it'll just be available to all Nevadans. And we had significant support. 85% Republicans and independents supported this bill. And over 90% of Democrats supported this bill across party lines. You know who are the strongest supporters of this bill? Remember I talked about mom? Women. Who knows who's taking care of everything? Who's the glue in our society? I may have a personal bias, but who's the glue in our society? Women, right? And who is fully supported, fully on board with this? Women. So we brought that bill in Nevada, brought it to the governor's desk. I have to say, Venetia Considine, Natha Anderson, Senator Cannizzaro, Leader Yeager, phenomenal supporters of this bill. Brought it to the governor's desk, and he brought out his veto pen.
And that still just makes no sense to me. And I can't even try to get into his brain about most things, but this one in particular, it has such a broad base of support that I cannot fathom why. Do you I mean, you don't have to get into his brain, but
to be honest, but I don't know what went into his thinking, but what we do know is that it wasn't about Nevadans. That's what we know. It wasn't about the patient. It wasn't about the person who goes to the pharmacy to get medication so that they can be healthy, they can work, they can be with their family, they can live their lives. It wasn't about them. That we know. Because if it had been, well, he'd have signed it.
It's a whole other conversation, but the through line of all of his vetoes was that he was not thinking about Nevadans and our families and our neighbors. So, Will, I'm going to come back to you, kind of basing off of that conversation with the Lieutenant Governor. What comes next in this fight for lower drug prices? Obviously, here in Nevada, we have great advocates and activists fighting for, the expansion of these negotiated prices. at the national level, what's the next piece of this fight?
So I think that there's going to be some elements that are going to be a continuation, and what's next is going to be a continuation from both sides. I think it's important that people know that people like Senator Mike Lee of Utah have introduced legislation to strip all of the drug pricing provisions of the Inflation Reduction Act. Congressman Andy Ogles of Tennessee has introduced a bill to do away with the entire Inflation Reduction Act. You mentioned at the top the number of pharmaceutical corporations who are filing frivolous lawsuits because they lost in Congress. They're never going to win public opinion, as the lieutenant governor was just talking about. So what do? Let's just, fire for effect with frivolous lawsuits all over the country. So we're going to continue to see that. But the good news is there's also a lot of proactive what's next. And, I mentioned at the top some of the leadership that we've seen from the Nevada delegation. That, too, is continuing. In fact, what you were talking about, what the lieutenant governor was making mention of about extending these savings, these cost savings and price bills to the private sector. And Senator Cortez Masto has introduced a bill just to do just that. In the House last month, ranking members Pallone of New Jersey, Nail of Massachusetts, and Scott of Virginia introduced a similar bill that, again, expands the number of drugs that extends these savings to the private sector. And these are all things that, to no one's surprise, the White House fully supports as well. And the president included in his 2023 and his skinny budget, and will continue to advocate for, because there is a lot of room that we can go. And this is the first step, or not even the first step, this is a major, monumental step, but more steps to come in the wake of this. And one other thing, I think, for your audience that I'd like to share with them, and I actually did this last time as well, and it's the difference between, because we see these words intertwined a lot in the media, but I do think it's important to point out the difference between price and cost. And if you look at sort of four major drug pricing provisions within the Inflation Reduction Act, two affected price and two affected cost. All four result in savings for Nevadans and people all over the country. So the two related to price are Medicare having the ability to negotiate the drug prices. Then there's also the inflationary rebate. And what this is if drug companies raise the prices of drugs faster than the rate of inflation, they have to pay a rebate back into Medicare, right? So to discourage them from doing these crazy price increases, which they tend to do twice per year, every January and in the summertime. The two that are affected cost are capping out-of-pocket costs for Medicare beneficiaries. That's at $2,000. That's going to go into effect in January 2024. And another one we've already made mention of, capping the price of insulin for Medicare beneficiaries at $35 per month, which went into effect January 1st of 2023. Again, I know that was a bit off topic, but I do think because price and cost are so used interchangeably, it is important, I think, for people to understand the difference between the two, and that both result into savings for, like I said, the people in Nevada and people all over the country.
Yeah, and I have a follow-up, actually, and Lieutenant Governor, feel free to hop in here as well. Is there an appetite? Have you seen any legislation that would kind of mimic what AB 250 here in Nevada would do at the national level? I know when I worked for Congressman Horsford, who's great on this issue, there was HR 3, the Lower Drug Prices Now Act. Do you foresee any sort of appetite at the national level to take kind of the AB 250 framework and expand these negotiated prices nationally for all patients? Or is that kind of a dream?
Yeah, no, you mentioned HR 3, and Senator Klobuchar has introduced a bill that basically took the framework of HR 3, removed all of the components that passed as part of the Inflation Reduction Act, and now that is sort of a marker bill for where folks should be moving ahead on drug pricing. I think including the bill that she also worked on with Senator Cortez Masto, extending to the private sector. I think to the closest version of that right now is probably on the House side, would be the bill that was introduced last month by Ranking Member Neal of the House Ways and Means Committee, Ranking Member Pallone of House Energy and Commerce, and Ranking Member Scott of the House Labor Committee. These are three ranking members who jointly introduced this bill. And like I said, the biggest thing it does, I think the top two bullet points, for the lack of a better term, you would see come out of that would be expanding the number of drugs eligible for negotiation right now and extending those savings to people with private insurance plans.
Awesome. And Lieutenant Governor, have you heard from any of your counterparts in other states, or have you had any conversation with folks in other states where something like AB 250 would be welcome there, and maybe they could be the guinea pigs, and we'll get to it next time?
So I should say that one of the criticisms of the bill in Nevada when we were trying to bring it was, oh, well, we don't want to be first. And my response was, Nevada is first in a lot of things, not things you'd like it to be first in, but we're first in a lot of things. So here is an opportunity to be first in a good thing. And Nevada has a history of actually trying to be first in a good thing when it comes to healthcare. If you recall, Governor Sandoval was the first Republican governor to expand Medicaid in his state. And that was pretty critical for Nevada. So it is not unusual for us to try to be first in something that affects so many Nevadans. But as a result of AB 250, there are approximately 13 other states now looking to do something similar. And we'll see where that goes.
That is incredible. That's awesome. I mean, we should be first, but that's okay. As long as some people somewhere are benefiting from your hard work.
Nevada's first in my mind. So
there you go. Lisa, I'm going to come back to you. I know Steve, our buddy Steve Horner, in the chat jokingly thanked George W. Bush for the donut hole. I know your mom fell into the donut hole. For folks who may not know what the donut hole is, can you give us a little bit of background there, and how, if you know, how this would interact with that?
Absolutely. The donut hole is basically when your prescription costs reach over $4,600, you have to pay 25% of your prescription costs until you reach $7,400. So that's the donut hole. And when your medication, so I'm going to give an example of, I have a medication that without insurance is $11,000 every 2 months. If I were to be in this donut hole and I don't have a reduction, I'm going to have to pay $25,000. I'm going to have to pay 25% of that $11,000 in order to take this medication. So that is why this is so very important, is because when you have people who are on limited income and they have to pay these huge co-pays, right? My mother's went from $180 to $480, right? For 2 months. She's going to have to pay that until the next Medicare year starts. And so it's really, really important, because if you have a lower price, then what she's going to be paying out of pocket while she's living in this donut hole is going to be a lot less. Now, if we can just kind of eliminate that, it would make life a lot better for a lot of seniors. But reality is that's what we have right now. And that's where a lot of people wind up. And this is when people start not being able to take their medication or rationing their medication and things like that, when they're faced with a $500 bill for their medication.
Yeah. And I understand your mom fell into that donut hole, and now this will definitely turn things around pricing wise for her.
Absolutely. she's very excited. I mean, she has been, as soon as she found out that medication is on it, she has talked to everyone about it. She's so cute. It's been so wonderful just to watch her just be this excited, and to watch my mom's friends be excited too, because they all have medications that are on this list, and they're going to see those differences. Now they're like, is it going to happen like tomorrow? And I'm like, no, it's going to take about 2 years. But they're very excited. My mom and my mom's friends are very, very excited about this, and I'm thrilled for them. And it makes it easier for me as I get older, because, I turned 55 this year. And so I'm getting up there to where I'm going to be on Medicare, but it makes me feel better that I know that some of these medications that I'm are going to be affordable for me when I get onto that kind of fixed income. So.
Yeah. So we kind of alluded to this a little bit in talking about the governor's veto of AB 250, that he, was not thinking about Nevadans who are going to be going to the pharmacy. Will, I want to come to you and ask, what resistance have y'all seen in this fight from Big Pharma yielding their influence? I know that there's also been a number of lawsuits that have come up in response to this. Can you kind of explain what you've seen at Lower Drug Prices Now and what the response from Big Pharma has been?
Certainly. It comes with a hefty price tag, and they have no shortage of funds. As you know, I've made this point a lot. It's an astounding number, but, pharma is an industry that could lose $1 trillion and still be the most profitable industry in the S&P 500. They have no shortage of funds. And we know that in the system, we have funds have the ability to have a profound amount of influence. You are going to continue to see a great deal of disinformation being put out by pharma to try to scare people into thinking that drugs aren't going to be available, that cures aren't going to be available, that people are going to get sick, and, oh no, there's not going to be a drug for that. Yet you never hear them say, yeah, now that because of this drug price, we're just not going to be able to pay our buyback stocks like we used to. We're just not going to be able to pay our shareholders all the billions of dollars that we have. So you're going to continue to see a great deal of fear mongering directly to people over airwaves from the pharmaceutical industry. At the same time, you will continue to see those who sort of are at the altar of big pharma campaign contributions carry their water. Like I mentioned a little while ago, you have people who have already introduced legislation to try to sort of just undo the drug pricing provisions of the Inflation Reduction Act. And that's happened both in the House and the Senate. Like I said, in the Senate, that's being led by Senator Mike Lee of Utah. And in the House, it's being led by Congressman Andy Ogles, who I refer to as sort of the George Santos of the South. If you haven't looked him up, I would encourage you to. I tend to know a little more about him than most, because if I still lived where I grew up, he would be my member of Congress. But they have both introduced bills to, like I said, undo the drug pricing provisions of the Inflation Reduction Act, or in the case of Mr. Ogles, to just totally undo the Inflation Reduction Act writ large. Then they will try to work on nibbling at it where they can't, make waves with an axe. They'll try to do so with a scalpel. And that's why it's so important that people like the Democrats in the Nevada delegation are not taking their foot off the gas. They're continuing to hold town halls in every corner of the Silver State, talking about how this benefits their constituents. They are writing letters to the editor and publishing op-eds. They are seizing earned media opportunities on television and radio to talk about this, because it is complicated, right? And to make people really understand what's on the horizon and will continue to be on the horizon, that is going to meaningfully and demonstrably improve their lives and the lives of their loved ones by making life-saving drugs more affordable. So I think that we will continue to see people introducing legislation that will strengthen the drug pricing provisions of the Inflation Reduction Act. I think we will continue to hear President Biden and Vice President Harris talk about efforts that they're considering, either through supporting and pushing legislatively or through executive action, to bring down drug cost and drug pricing for the American people. And I do believe we will continue to see the opponents of our successes continue to try to burrow new avenues into, once again, fattening the pockets of big pharma. And unfortunately, that only happens at the expense of American patients, many of whom live in Nevada.
Yeah. LG, I want to throw it to you. I saw that you had your hand raised.
Yeah, I mean, what Will's saying is that elections matter.
Yes.
And so we have elections coming up in a year from now, right? We have a Senate race in Nevada, Senator Rosen. I'll tell you where Pharma's going to be spending a lot of its money. Pharma's going to be spending a lot of money trying to flip that U.S. Senate so that they can strip that Inflation Reduction Act. So if you're a senior citizen out there, your vote matters. We have the opportunity. So our governor here, I don't know, you might want to call him Veto Joe, because our governor here just got a little trigger happy with the veto pen there. And if there are most, yeah, he got a little excited. So if you have elections here, which we do, the Nevada State Senate legislative Senate is one person away from a 2/3 majority, where you can then say, wait a minute, we're talking about people, we're talking about patients. So I think Will mentioned, our congressional delegation was very keen and very aggressive. They are up for election. Congressman Susie Lee, Congressman Horsford, Congressman Titus, these people are up for election. Votes matter. Elections matter. The 2/3 is up for election. Vote, flip the page and vote all the way down to your state senator. From the lofty to the lowly, I like to tell people, your vote matters. And it matters, it will matter very much with respect to the cost of your prescription drugs in this next election.
Yeah, it matters at the polling place and it matters at the pharmacy. Lisa, I want to come to you because I know we've been talking about how your mom, Teddy, we love her. She is a Republican, and this is an issue that she's hyped about. She's sharing it with her friends. So it's truly a bipartisan issue. Is it something that you believe folks like your mom will take with them to the polling place?
Absolutely, I do. When you threaten somebody's security and you threaten their health, this is something that people take very seriously. So if overturning this becomes a topic in the elections, this is a conversation that people are going to be having. Because this is, like I said, this makes a difference that my mom and dad can have people over at their house. They can afford to entertain. They can afford to do things because that's how they can be active, right? And so this matters to them. And it matters to their friends. Like I said, this is, there's always an adage that you don't go against the senior citizens, because these are the people who are going to vote. And if you go against what is in their best interest, they're going to vote against you. And I know that my mom has made that really clear, and a lot of her friends are. And as I sit down and I talk to them a little bit more about this, they all get really jazzed. And, you know, I have to have my little list of all the drugs so I can tell them, and we can check off who's got what and everything else. And it's exciting to them. And it's exciting to me to be able to bring that information to people. And again, it's exciting for me as I'm creeping up there. It does make me, you know, it gives me comfort, and it gives me that, you know, we're on the right track of take care of people as they're older, because we historically do not do that in our society.
Can I just jump to say one thing that actually built on what Lisa and the Lieutenant Governor were saying? And where you're going, because pharma knows also that it's easier to take something away from somebody that they don't yet know that they have. And I mentioned that these first 10 drugs were announced, and those fair prices are going to go into effect in 2025, and then we'll build upon that. Pharmaceutical industry knows that once we're at a place 2, 3, 4, 5 years from now, where people are really seeing this, where we're negotiating 35, 50, 65 different drugs, and that's resulting in real savings for people. They know that it's going to be much, much more difficult to take that away, because people are going to go to a town hall and say, what? Hey, everybody vote for me. I'm going to increase your drug prices, right? So to the Lieutenant Governor's point about the importance of elections, about the importance not only of elections, but the importance of the elections that we are, 13 months from right now, in which they are absolutely going to want to try to flip the Senate. They are going to know they've had their eyes on wanting to take Susie Lee out since 5 seconds after she was first elected. They're going to go after Congressman Horsford. They came after Congresswoman Titus last year. They're going to come after Senator Rosen this year. And the good news is the Nevada delegation, time and time again, makes news for doing things like this that benefit Nevadans. And I would just I only raise that because of the comments of the Lieutenant Governor and from Lisa about the importance of elections, and really sort of couching that with the idea that pharma knows the best shot they have at undoing these successes will be in the next 2 to 4 years, because after that, it's going to be a bridge too far in the eyes of not only people in Nevada, but people all over this country, because they don't have to be, watch Morning Joe or read the paper and the op-ed section every day to really be as aware of it as we all are.
Well, so that brings up a really good point. So what are some of the things that pharma is going to say, and what is the counter to some of those things? So Will brought up the fact that pharma will say, well, we won't be able to do research and development, right? So 2 points to know. First, they spend more on advertising than they do on R&D. Okay? They spend more putting fancy people in front of you on your TV than they do on research and development. The second thing about that is that the Congressional Budget Office, which is a nonpartisan office, took pharma at its word, said, okay, we'll do an analysis. Just how much is this going to affect R&D? And they produced a document that said, well, over a decade, there may be a maximum of 2 fewer drugs. Okay, so when pharma says, "Oh my God, that's it, the sky's falling," there's your answer. Now, the other thing pharma says, well, there's going to be shortages. Now, many of you read in the paper, we've had shortages recently. We have not had negotiated prices, but we've had shortages. And so the question is, well, wait a minute, what do you? You said that you acted like there wouldn't be shortages unless we had the Inflation Reduction Act, but there's shortages anyway. So that, again, is a red herring. So to be cognizant. And then they'll say to you, well, it's price fixing. Well, I'll tell you what price fixing is, because I'm an antitrust lawyer by trade. Price fixing is when a monopolist sets the price and you don't get to negotiate. Now, we had a question of, well, who controls prescription prices? Well, the pharmacies, the pharma is price setting. They are setting the price. There is no competition and saying, this is what you're going to pay. You're going to pay, what did Lisa say? Something 88, 688 or 588 or $488. All right. That is price setting. Competition, which is what our economy is built on, is when you negotiate. When you negotiate the price. That's what Medicare is going to do. And that's what we're going to get. So we're going to get to a situation where we have competition, which is what this country believes works in an economy. Where we are now is a situation where pharma is price setting. And we're going to move away from that. So this is how I throw in a few little arguments there so that people can go armed when they hear this silliness.
Oh, I love it. You are always an expert and you always have the best comebacks, the best strategies. Lisa, I want to throw it to you. I know you had your hand raised as well.
Yeah, actually. So one of the biggest things that people can do around talking around this is you're a trusted messenger. You are here listening to this. You are getting the facts. You know where you can turn. I mean, you can contact any of us over at BBP. And we can get you to where the facts are. And you're a trusted messenger. I'm a trusted messenger to my mom's friends, right? They're coming to me to ask me questions about this. They're coming to my mom because my mom was on TV about this. So suddenly she's the expert on this, right? And so you being a trusted expert or a trusted messenger, you can relay that, whether it's one-on-one talking to your family about here's the reality of what this of what the Inflation Reduction Act is doing and how it's going to help you, how it's going to help other people, why this is important. You can put it up on social media. There are a ton of places where you can, even if you follow us, we have been posting a lot around what the benefits are. So be that trusted messenger. That is the best way for us to get this conversation elevated and to drown out the money that Big Pharma is going to be able to push, is if we have a wave of people having these conversations and telling the truth and not falling for there's a shortage. You're not going to be able to get anything. I mean, I was prescribed Ozempic, which is a drug, and my pharmacist said, oh my God, you're lucky to get it because we can't get this. We can't keep it in stock. That's not on the list. Nobody's negotiating for it, but yet nobody can get it. I was lucky. I'm also allergic to it, but that's a whole nother set of conversations. But this is what we can do. And us doing our part is huge.
Yeah. Thank you so much, Lisa. And a part of being those trusted messengers, well, first of all, for folks who don't know, Lisa runs our anti-disinfo program. So she is all about being a trusted messenger. And if you want to get involved, she can help you get involved. I want to give a quick shout out in terms of folks that are having those conversations with their relatives. Brian on our team, our new lead organizer, his grandpa is tuning in. So shout out to Brian's grandpa. And he was spending $162 a month on Eliquis. He was on Januvia, which was costing $171 a month. And now he's on Jardiance, which is $163 a month. That went up over the last year, and he went into the donut hole. So now Brian gets to talk to his grandpa about these price changes. I hope you'll have a lovely chat about that. But we are the best messengers to engage folks around these issues. If you have loved ones that are on these drugs, make sure that they know that this was a promise fulfilled by folks in Congress and folks in DC. and that folks are still fighting to lower those drug prices. Before we go to some final thoughts, LG, I have another just question for you around here at home. What is next for you and the work that you're doing to lower drug prices? Do you think AB 250 will rise from the ashes? What do you think is next?
Yes, absolutely. I mean, just because you get one veto doesn't mean that you stop fighting. I mean, let's get serious here. This is about people. So yes, we will come back next session. People will be more familiar. They'll see what drugs now are on the initial list. And I think that then we'll be able to have some more conversations. Certainly, if we are fortunate enough to have 2/3 in the state Senate, then the governor will have to be more judicious about what he intends to veto, since we'll be able to override that veto. So perhaps that will lead to negotiations so we don't reach that point, so that we can talk with him about these issues. And I have to tell you that Richard Whiteley, who's head of the Health and Human Services in Nevada, is a phenomenal man, really knows his stuff. And I did not get the chance to speak to him about this last session, but then I hope that we will be able to sit down to the table this session, because that's always a better way to go than to get to the point where you're vetoing and overriding a veto. So hopefully, like I said, elections matter. If we have the 2/3, then maybe we all get to the table and figure out a way forward for the people in Nevada. A healthy Nevada is the goal. That's the goal. And you can't get healthy if you can't afford it.
Absolutely. All right. Well, I want to thank all of you for joining us. I want to go to some last thoughts from folks. I know we've covered a wide breadth of topics and the what's next on this, but Lisa, I want to start with you for some final thoughts around these negotiations. How are you feeling about them? How's Mom feeling about them?
Well, as I've said before, we're excited. My mom's excited that in a couple of years, she's not going to be faced with this exorbitant increase for half a year. She's very excited about that. I'm excited for them. And my last thought is, let's talk about it, folks. Bring it up to your friends. Bring it up over the holidays, right? It's the perfect time. If you don't want to talk politics, talk about pharma. Talk about big pharma. That'll be fun. But have those conversations, with your family, with your friends. It's the best thing that we can do to make sure that all Americans and all Nevadans have access to affordable prescription drugs. It's something that's essential.
And Lieutenant Governor, I'm going to come to you, but first we have a note from Steve, our good friend Steve Horner. He says, I have COPD and my wife has cancer, and I am in the donut hole by May most years. And you can count on him for testimony next session. So Steve says hello, and that you can count on him.
To change something that affects this many people in the country and generates so much profit is hard. It is not easy to right the ship and put it in the right direction. And so I want to, my last thoughts are to give a shout out to the people who were moved forward on this. Our congressional delegation, Senator Klobuchar, Venetia Constantine, Natha Anderson, Steve Yeager, Nicole Cannizzaro. I want to give a shout out because it is not easy to push things to a direction where the arc of justice starts coming towards us. And so I want to say we owe a lot to those elected officials who stood forward, knowing that pharma would then come after them. They stood up for us, and that's very important.
That's very brave. Will, I'm going to come to you. I know that you and our friends at Lower Drug Prices Now and Healthcare for America Now are on the front lines of this fight every single day. Any final thoughts for folks?
Well, once again, and this is what happens when you're on a panel with such talented people, you say, building upon what was just said, that I agree with everything, but I really started thinking about it when Lisa was talking about, conversations in the break room, at work with your family. And then following Lieutenant Governor's comments, I can't overstress to people, if one finds oneself at a town hall, in the grocery store, or anywhere in between, and comes across one of the elected officials whom we've mentioned this evening, there's a tremendous amount of value in saying thank you, and acknowledging the hard work and the brave stance that they took. Particularly, I mentioned at the top of the call, by the time we got around to last Congress, all three Nevada House Democrats were what are considered frontliners, right? Because they were under such threat and under so much money was being spent against them. They all three were reelected. But from the very beginning of last Congress, Susie Lee was on that list. And I went back and looked right before this call. The very first time there was a frontliner letter to the White House, when we weren't sure if drug price divisions were going to be part of the inflation, what became known as the Inflation Reduction Act. And Susie Lee was among a group of frontliners who wrote a letter to the president saying, this is extraordinarily important to our constituents. We really, really want to see drug pricing provisions make it into Build Back Better back then, as we were still calling it. To the Lieutenant Governor, doing so knowing that is the invitation to have literally hundreds of millions of dollars spent against you and against your colleagues, for the preservation of exorbitant profits by a few pharmaceutical executives. And Susie Lee never wavered from that. And of course, Dina Titus and Stephen Horsford were great throughout the whole time. But people took stances when they didn't necessarily have to, but they did it because it was the right thing to do. And it was a thing that was best for their constituents. And saying thank you goes a long way. And it's something, myself included, we don't take enough time to do in the wake of big victories like this.
Definitely. And I know it is always appreciated whenever our congressional delegation gets recognized for the hard work that they do. With that, I'm going to go ahead and bring us to a close. I do want to say, if you want to say thank you to some of our amazing congressional representatives, you can see some of them next week at Celebrate Progress that we're hosting on Wednesday, September 6th at 6 p.m. at the Paiute Golf Resort. I know it's a little bit far, but we love it out there. And last year it was a beautiful event. We're so excited to have it there again. If you want to get your tickets, there are still in-person tickets available, but there are also virtual tickets. Roxy is very excited about the virtual ticket option at bit.ly. That's bit.ly / and this is all caps, CP23 RSVP. And our team will put that in the chat. So we hope to see y'all there. Thank you again to our esteemed panel. And if you have any questions about how to get involved, our team is always here and at the ready and in the chat to help you share your story about how lowering drug prices impacts you. Thanks all and have a great rest of your Thursday.
I'm buzzing, let's drink up. Your death look like big fun. Come on, let's get it on. Like that Marvin Gaye song. I'm stunning, you love it. Come on, give me something. I know that you want it. Come on, give me something. The night is young and so are we. So maybe you should leave with me. The night is young and so are we. So let's have some fun. If you love me right, yeah, this could be the summer. you love